Liquoguard 7 is a fully automated CSF management system that simultaneously measures pressure and drains CSF. Liquoguard may be set to maintain a specific intracranial pressure, or set to continuously drain a specific volume of CSF each hour. Liquoguard automatically drains CSF at a user-defined flow rate, whenever the patient's CSF pressure is greater than the value of P set, and the device is not in pause mode. When in pause mode, Liquoguard continues to measure the patient's CSF pressure, but will not drain CSF. When the patient's CSF pressure is at the value of P set, or when the CSF pressure drops below P set, Liquoguard automatically stops draining CSF. When the patient's CSF pressure increases above the value of P set, Liquoguard resumes draining CSF to reduce and maintain the patient's pressure at or slightly below the value of P set. Liquoguard 7 may also be programmed to continuously drain a specific volume of CSF each hour independent of the patient's pressure. When the patient's CSF pressure remains above the value of P set, Liquoguard drains CSF continuously at the user-defined hourly flow rate. Set the volume of CSF to be drained each hour. As the patient's CSF pressure is typically greater than 0, Liquoguard will continuously drain CSF at the selected hourly flow rate. When Liquoguard 7 is placed in pause mode, it continues to measure the patient's CSF pressure, but will not drain CSF. Pausing Liquoguard is analogous to clamping a gravity drain. While in pause mode, Liquoguard continues to check the catheter and drainage line for patency. If at any time the catheter becomes occluded or mispositioned internally, or if the catheter or tubing is kinked externally, drainage stops and Liquoguard sounds an alarm. For additional information, please refer to the Liquoguard 7 Instruction Manual, the Liquoguard 7 Quick Reference Guide, and Liquoguard 7 Alarm Guide.